Hello. Today I am interviewing Dr. Kasoon Mauldin. She is a professor and the dietetic internship program director in the Department of Nutrition, Food Science, and Packaging at San Jose State University in California. She also practices as an outpatient clinical dietitian on a relief basis at Stanford Healthcare. Dr. Mauldin, please tell us about chemistry in the context of nutrition practice.
Thank you so much for inviting me, Dr. Kelly. Chemistry in the context of nutrition practice. So one of the questions that I often have been asked when I taught the intro nutrition class was, what does chemistry have to do with nutrition? Because that's one of the prerequisites for intro nutrition was general chemistry. And what I like to do is ask the students, well, what are nutrients in our food made of? Shown here on this slide are some of the macronutrients that we consume, that we eat. So the macronutrients such as water, carbohydrates, fat, protein, and even the micronutrients, the vitamins and minerals, all of these that we consume in our food are made up of chemicals, and they're chemical compounds. And these nutrients or chemical compounds are used to make energy in our bodies via biochemical pathways, right? And the amount of energy that we get from these macronutrients, so carbohydrates, protein, and fat, the energy yielding macronutrients, the amount of energy that we get per gram of these is directly determined by the chemical structure of that nutrient. So really, in essence, nutrition or metabolism is how living organisms use chemical processes to maintain life by converting these nutrients into energy. And when you think about nutrition, it's really an applied science. So learning chemistry is really the foundation for understanding metabolism and the application of nutrition in clinical practice. Here on this slide, I have another example. So this example is how chemistry and biochemistry is used in nutrition clinical practice. So one of the tools as a registered dietitian that we use is indirect calorimetry. And indirect calorimetry is the method by which a metabolic rate, or you can think of it as energy expenditure, is estimated from measurements of oxygen consumed and carbon dioxide production. And we do this using this what's called a metabolic cart, or this portable indirect calorimeter shown here in this image. And you may wonder, well, why would measuring oxygen consumed and carbon dioxide expired estimate energy expenditure? Well, indirect calorimetry is based on this principle that nutrients enter our bodies as carbon-containing compounds and then are metabolized into known amounts of ATP, water, carbon dioxide at the cost of oxygen. So this is oxidative phosphorylation, essentially. And the equation shown here is the Weir equation, which utilizes this principle, and the measurement of inhaled volume of oxygen and exhaled volume of carbon dioxide is used to translate the information into energy expenditure. And in clinical practice, a registered dietitian would use an indirect calorimetry study to determine energy expenditure in situations where it may be difficult to estimate energy needs based on predictive equations. And knowing the energy expenditure will help the registered dietitian know how much to feed a patient that may be on like tube feeding or IV feeding. And so now I've brought up this term registered dietitian. You may wonder, well, what is a registered dietitian? So registered dietitians, we're also known as registered dietitian nutritionists. We are food and nutrition experts. In the course of our studies, we study, for example, food science to understand our food supply and food safety issues. We also study a lot of basic science courses and apply this knowledge gained from basic science classes, such as chemistry, biochemistry, physiology, to provide medical nutrition therapy to our clients and patients. And another question I often get asked by students is, what's the difference between food science and nutrition? And the way I think about this is, first of all, these two fields are interconnected, but you can think about food science as being the study of food before we eat it, and then nutrition as being the study of what happens to that food in our bodies after we eat it. So to become a registered dietitian, there's quite a bit of coursework that I've listed on this slide that you have to take. And these are all a part of an accredited didactic program in dietetics. And dietetics is really what's called an evidence-based practice. And this means that dietitians must be able to review, analyze, and translate the latest scientific literature or scientific evidence, and then use this evidence that comes from the peer-reviewed literature, use this evidence in making decisions in helping our patients in terms of providing medical nutrition therapy. Registered dietitians work in various settings. So here are just some images of examples of what types of settings registered dietitians work in. Definitely hospitals and clinics and other healthcare facilities, such as dialysis centers. Registered dietitians can also manage food service operations, especially at school districts or healthcare facilities. They also work in food and nutrition related businesses and industries. We can do research in areas of food and biotechnology. Registered dietitians also work in community settings and public health settings. Sports nutrition is another area, and then corporate wellness programs and even teaching at universities. I'll wrap up by just sharing with you some of the steps required to become a registered dietitian. To become a registered dietitian, one does need to have a graduate degree or advanced degree and to have completed a didactic program in dietetics. And when you complete a didactic program in dietetics, you'll get a DPD verification statement. And then after that, the second step is to obtain a dietetic internship or supervised practice and complete those hours. Then after that, you would have to pass the national RD exam. So it's administered by the Commission on Dietetic Registration. So the registration exam. Once you pass the exam, you become a registered dietitian. In some states, it's required that you get licensure. So you have to determine if the state that you're practicing in requires that. And then every 5 years as a dietitian, you have to document continuing education to maintain your credentials. So if you want more information, I've provided a link below and you can figure out if becoming a registered dietitian is something that you're interested in. But it's definitely a field where you can apply chemistry and other basic science courses and knowledge into practice.
Thank you so much, Dr. Mauldin. This was certainly very informative.